Hi, I'm Kiana. This is for week 10 of pharmacology tutoring, GI drugs, and this video is going to cover anti-diarrhea drugs as well as anti-emetics, which means anti-vomiting. So anti-diarrhea drugs, I guess I should just say drug because there's only one. Low paramide, I remember it as slow paramide because you want to slow things down when you have diarrhea. So it binds to intestinal opioid receptors and it slows the transit, hence the slow paramide. It reduces the volume of stool. Because it's slowing that time, more water can be absorbed from the stool, and the stool, therefore, it's less diarrhea consistency. It's also going to increase the tone of the sphincter, and if you use too much of the drug, the person might get constipated, which is not good. Don't use in GI infections because obviously if the person has something like E. coli 0157 or Shigella or Campylobacter, Yersinia, you want to get it out, and that's kind of the point of the constipation, is that flushing action. So by using an anti-diarrhea drug, the point of the diarrhea is that flushing action. By using an anti-diarrhea drug, you're going to keep that infection inside of your body, so don't give anti-diarrhea drugs to a patient with infectious diarrhea. All right, slow paramide, good to not have diarrhea. Anti-emetics. Ondansetron. It's used in chemotherapy as well as pregnancy, so it's safe for pregnant women. It blocks the serotonin 5-HT3 receptor on the vagus nerve, and remember the vagus nerve goes down the esophagus to the stomach. I remember it as "oh darn, stay down." It just kind of looks like that when I look at it. So, "oh darn, stay down." You don't want your food coming up. Anti-emetic, ondansetron. Prochlorperazine. Anti-emetic, and it's also a treatment for psychosis. It blocks dopamine in the brain. It's very sedating because of that effect. Don't use in CNS depression or a coma, and it can cause breast discharge, which is also known as galactorrhea, and drowsiness or sedation. So this is a little more hardcore on the anti-emetic side. And I think everyone knows diphenhydramine, also known as Benadryl. It blocks the H1 receptor, histamine 1. It's useful in motion sickness, allergies, and swelling of the skin related to allergies, also known as angioedema. So it can also reduce emesis. So if someone has motion sickness and feels kind of nauseous, diphenhydramine or Benadryl may help. All right, that's anti-diarrhea drug and anti-emetics. If you have any questions, feel free to email or reach out. Otherwise, happy studying.